Hemorrhoids are prominent and swollen veins in the anus, and in the lower rectum, formed as a result of effort during bowel action, or as a result of severe pressure on these veins, such as during pregnancy. Hemorrhagic disease is a very common disease, even at the age of 50, affecting about half of adults. In the majority of people, there is an improvement in the symptoms of hemorrhoids after the use of home therapy methods to treat hemorrhoids and change the life system follow. There are 4 types of hemorrhoids. External hemorrhoids. They are found in the anus directly on the surface from which the feces emerge, always invisible, but sometimes seen as blocks on the anal surface. External hemorrhoids are not usually a serious medical problem. Internal hemorrhoids. They are usually found in the rectum, and cannot always be seen because they are so deep they are not visible from the anus. Internal hemorrhoids are not usually dangerous and tend to disappear on their own. Descending hemorrhoids. Descending hemorrhoids appear when internal hemorrhoids swell and stick to the anus, and the hemorrhoids appear to drop, such as swollen red blocks or bumps outside the anus. Curdled hemorrhoids. Thrombocytopenia contains a blood clot inside the hemorrhoid's tissue, and may appear as blocks or swelling around the anus. Blood clots can occur in both internal and external hemorrhoids. Symptoms of hemorrhoids. The symptoms of hemorrhoids vary from person to person, and vary depending on their type. General hemorrhoid symptoms. In the case of hemorrhoids in general, the following symptoms may appear. Painless bleeding during bowel movement. Sometimes a little shiny red blood can be observed on toilet paper or on the toilet tub. Itching or irritation in the anus area. Pain or discomfort. Visible and prominent hemorrhoids outside the anus. Bulge around the anus. Painful or highly sensitive bump next to the anus. Fecal leakage. Symptoms of internal hemorrhoids. The symptoms of hemorrhoids inside the rectum cannot be seen or felt, and usually do not cause discomfort. But the effort or burning when crossing the stool may wound the exterior of the hemorrhoids, causing bleeding. Sometimes, especially when exerting effort, internal hemorrhoids may rush out, and these are called protracted hemorrhoids, or descending hemorrhoids, and can cause pain and itchiness. Symptoms of external hemorrhoids. One of the most important symptoms of hemorrhoids is their arousal, and irritation can cause itching or bleeding. Sometimes blood may tighten and attract external hemorrhoids inward, consisting of thrombus, causing severe pain, bloating, and inflammation. Causes and risk factors of hemorrhoids. Veins around the anus usually tend to contract as a result of pressure, and can swell. Swollen veins may swell as a result of extreme pressure in the lower area of the rectum. Among the causes of hemorrhoids, genetic factor. Age, because tissues supporting rectal veins and anal veins weaken and contract as age ages. Factors that increase the risk of infection. Hemorrhoids can result from one of the following factors. Voltage during bowel work. Prolonged and continuous sitting on the toilet tub. Chronic diarrhea or chronic constipation. Excess weight. Pregnancy dial. Anal sex. Complications of hemorrhoids. Complications are rare, but if any they may include anemia. Chronic blood loss as a result of the disease can cause anemia. Choked hemorrhoids. This occurs as a result of the interruption of blood supply and suffocation, which can lead to acute pain and eventually to the death of the tissue, necrosis. Diagnosis of hemorrhoids. The doctor diagnoses by diagnosis of external hemorrhoids. Proctologist can only consider. Initial internal hemorrhoids diagnosis. The doctor needs to insert his finger covered with a rubber glove into the rectum. Advanced internal hemorrhoids diagnosis. The doctor examines the lower part of the intestine and rectum by anoscope, proctoscope, sigmoidoscope. These binoculars are soft and luminous tubes that allow the doctor to look inside the anus and straight. These drugs contain substances such as hydrocortisone, lidocaine, which relieves pain and itching even temporarily. Do not use the cream that contains steroid and is sold over the counter for more than a week, unless the doctor advises you to do so. Doing this will cause skin thinning in the area. If your external hemorrhoids cause painful clotting, the doctor will probably get rid of this clotting by creating an incision for clotting drainage, known as thrombectomy. This process is highly effective if applied within 72 hours of thrombosis in the area. If your hemorrhoids are associated with bleeding and pain, the doctor may advise you to use one of the minimal interventionist procedures, which can be applied in the doctor's office without the need for anesthesia. These options are treatment of hemorrhoids with rubber tape, sclerotherapy, coagulation. If previous treatments do not work, and the size of the hemorrhoids is large, you may be advised to use available surgeries. These include hemorrhoidectomy. In this process, the surgeon disposes of excess tissue that causes bleeding. The surgeon may use local anesthesia associated with calming, which is the most effective process that helps to fully treat hemorrhoids. The process may cause difficulty in completely emptying the bladder, and urinary tract infections,